Hello, my name is Dr Maureen Baker and it's my pleasure to introduce you to the Health Apps Library. In this video, we're going to talk about how we ensure that the apps listed in the library are safe and trusted. More and more people are using apps to help manage their health. Generally, these apps are used either to find out more about our conditions or to help us interact with health services online. Clearly, technology has the power to transform our lives for the better, but at the same time, we need to make sure that these apps are safe for people to use and will not cause them harm. Just as we expect industries like aviation and transport to have standards that protect people's safety, so we should expect the same of the health and social care sector. That is why we in the NHS have led the way in developing standards for safety in health technology, and now we are applying those same standards to health apps. All apps submitted to the Health Apps Library are checked to make sure they're relevant to people living in England, comply with data protection laws, and they're based on trusted sources of information such as NHS Choices. Once the app has met these minimum requirements, we then check to see if it could potentially cause harm to a person's health or condition. For example, is the app limited to providing information from a trusted source? Or might it go on to provide personalised medical recommendations or treatment options? If so, then potentially there could be harm caused by improper use of the app, and so it's these apps that we want to check out to make sure that they are safe. Our clinical assurance team, which is made up of doctors, nurses and safety specialists, work with the developer of the app to make sure that it complies with our safety standards. During this process, any potential safety concerns are identified and either designed out or dealt with so that any remaining risk is at an acceptable level. Of course, we can never assure anything to be 100% safe. Crossing the road isn't 100% safe, but if you stop, look and listen, you are much less likely to come to harm. That's exactly the sort of thing we're trying to do here with the Health Apps review process. As this is new territory, we are learning as we go along, and it's likely that our review processes will be updated and improved over time. But we will always ensure that there is a clear explanation about the work we are doing as regards safety in health technology. If you have any thoughts about how this process could be improved, please do fill in the feedback form that can be found at the bottom of every page on this website. And thank you for your interest in the Health Apps Library.